Today, we've got three great panelists that Rebecca will introduce in just a minute to talk about how student groups, STEM student groups, have been really leading the charge and getting involved with their communities in response to the COVID-19 pandemic. This event is hosted by two groups, engineers and scientists acting locally and the National Science Policy Network. I'd like to introduce myself really quickly. My name is Arti Garg, and I am the founder and chair of Engineers and Scientists Acting Locally. If you're not familiar with us as a group, our mission is really to get more engineers and scientists involved with local government and with their local communities. And we do that through events like this, just helping you understand ways you can get involved in your local community, and events that are more directed at policy engagement. We have a lot of resources on our website, so we would love to have you, come visit our website, sign up for our newsletter, and learn more about what we do. With that, I'm going to turn it over to Holly Mayton to tell you a little bit more about the National Science Policy Network.
Thanks so much, Arti, and hi, everybody. My name's Holly Mayton. I'm the Director of Partnerships at the National Science Policy Network, and our mission is highly aligned with ESAL's, but we're looking to get more young and early career scientists and engineers involved in science policy broadly, whether that's at the federal or the local or the state level. And we really do that through building community, creating training opportunities, and creating more pathways for our chapters and members to engage in policy, advocacy, communication, whatever it is they're interested in. Thanks, Rebecca, for dropping the link in the chat. I would love to have all of you become members of NSPN. You'll hear from one of our chapters today at UC San Francisco with Alina, and we have chapters all over the country. So would love to connect with anybody who's interested in learning more. And thanks so much to our panelists and to ESAL for helping us host this today.
Thank you, Holly. And with that, I'm going to turn it over to Rebecca to moderate today's event. Rebecca is a sixth-year graduate student in the biological sciences in public health at Harvard University's T.H. Chan School of Public Health. She was also summer science policy intern at Research America last year in 2019. And currently, much to my pleasure, she is a volunteer with the ESAL events team. Take it away, Rebecca.
Great. Thanks, Arti, and welcome everyone. So just to give a little bit of a rundown of how the logistics for today are going to go, each of the panelists is going to talk for about 10 to 15 minutes. They have some great presentations for you, and then we're going to move to a moderated discussion. So throughout the presentations and during the discussion part, please feel free to use either the question and answer box or the chat to input questions for the panelists. We hope to get a discussion going. You'll also note that we'll be trying to drop in links in the chat throughout the session as well on relevant material, which hopefully will be useful for you. Before I introduce the three wonderful speakers that we have, I also want to give a shout out to my colleague on the events team, Shan Lee, who actually did most of the work in organizing this event, but unfortunately wasn't able to make it here today. And also to note that the ESAL events team has a bunch of cool things coming up on the docket, including one on that I'll drop in the chat on healthy buildings and COVID-19, specifically focused around healthy buildings and school systems that will happen on December 2nd. So with that, it's my pleasure to introduce our three speakers. First up, we will have Serena Wang, who is a fourth-year student at Johns Hopkins University studying public health. Serena co-founded COVID SMS, which you'll hear a lot more about, with the idea of harnessing powerful technology to combat social inequality and mitigate the digital divide. Next, we'll hear from Alexandria Lee, who's the co-founder of Students versus Pandemics. Alexandria is a graduate of the Harvard Chan School of Public Health with an MS in epidemiology, and she is committed to addressing public health issues with a focus on the intersection between environmental health and reproductive and pediatric health. She currently works at the LA County Department of Public Health to address COVID as a health program analyst on the outbreaks management team. And then finally, we have Alina Kay, who is a PhD candidate in the Developmental and Stem Cell Biology program at UCSF, and she's the leader of the Science Policy Group at UCSF since 2018. Alina has worked on advocacy, mutual aid, and political campaigns related to gender and racial equity, biotechnology education, and justice system transformation. So with that, I will pass it on to Serena to kick us off.
Hi, thank you. So let me just, okay, perfect. Hi, I'm Serena Wang, co-founder and CEO of COVID SMS. As Rebecca was saying, I am a senior currently at Johns Hopkins studying public health. And so as a community leader, I have worked very closely with people experiencing homelessness and of low-income communities. And so while volunteering at a food pantry during the early months of the pandemic, I met a man named Mark. And so just a little bit of brief background on my team before I go into my story with Mark. The original team consisted of just 6 Stanford and Hopkins students, but now we have over 30 members in 4 teams: tech, finance, marketing, and community outreach. So we have students from all different backgrounds in public health, computer science, marketing, econ, finance, biology, and we are a texting service, but we really are a team of dedicated and passionate individuals hoping to serve the communities that need it most. And so with my story with Mark, I had recently found out that he was unemployed from his custodial job, and he found himself living on the streets. The worst part was that his laptop had been stolen, and so he had no access to the internet. And so he was asking me very basic questions, such as, what were COVID symptoms? How do I prevent myself from getting COVID? What was social distancing? And how could he get tested? And so I realized all of this information was stuff that I could easily Google or just simply look up on the internet. But Mark only had a very basic flip phone, which he was showing me. And so he couldn't get any of the answers that he was asking me about. And so recognizing this problem, we gathered a team of students and we created COVID SMS in one weekend. So just a little bit about who we are. COVID SMS is a free-to-use text messaging platform that allows community leaders and city officials to disseminate essential information and resources via text. SMS is streamlined, so there's no need to download any apps and have internet access. It's universally intuitive in that most people know how to text. SMS is accessible. 96% of low-income Americans have a phone, but only 54% have a computer and only 56% have home broadband services or internet access. So actually half of America doesn't have the same privileges that we do right now, being able to be on Zoom and on our computers and with internet access. And SMS is efficient. So SMS messages are opened over 95% of the time, so it becomes the most effective and impactful way of communication. And if you actually want to try our service for yourself, you're able to text in this number that we have right here. And with this number, we provide zip code specific data, so the number of COVID cases and deaths specific to where you are currently located or whichever zip code you enter. So as a team, we felt that it was our mission to serve. And so I just wanted to go through an example phone number of one that we built. So how we work is that, let's say Mark, this individual that I met, receives a flyer while he's waiting in line at the Hope Food Pantry. So he receives this flyer and he reads that he can follow the directions by entering his zip code at 833-997-0500. So I'm actually going to show that. So he would enter his zip code, and this is my text messaging app. And the zip code, let's say that he's at, is in Utah, Salt Lake City. And so he would text in his zip code. So it has an error right now because I've actually already texted in the number before, but then he would receive an option menu with different options that he could text in for. So he could text in about testing sites, subscribing to announcements, receiving COVID FAQs, food assistance, updating his zip code, and we're also in Spanish. So he had questions about testing sites, so he could text in A. He would then receive the testing sites closest to him based on the zip code that he had entered, so 84111. And these are the two closest testing sites, and he could easily call in by just clicking on these phone numbers. He can also subscribe to announcements. And so right now, as a team, we've been providing community leaders, nonprofit organizations with specific customized phone numbers. And we've been giving these community leaders broadcasting portals. And so I'm going to switch over to my screen right here. And so let's say I am a community leader at Hope Food Pantry, and I receive my login information and my password, and I sign in. And I can actually schedule when I want my next announcement to be. So let's say I have a food event. Would you like to RSVP? And so this question can actually be, or this message can be a question, and I can submit my message. And so Mark will immediately receive the text message and he can respond. So just going back. We have additional customizable features. So for each of our partner, we really emphasize and prioritize addressing the needs that they recognize in their own community. We recognize that as students and as not necessarily long-term residents of the communities that we're in, we don't know what their needs are. And so we really emphasize on working directly with these community partners to best serve the need of their community. So individuals can receive access to other crucial information and resources such as mental health resources, rent assistance, unemployment information, anything that the community leader believes is best for their community. And so the two-way communication feature that I just showed greatly helps community leaders have a streamlined form of communication. And our team also handles all of the maintenance of these phone numbers for each of our partners, meaning that they don't need to have any of the technical expertise or even resources to create an innovative phone number for their communication platforms. And so just 6 months ago, we were nothing but a team of student volunteers with an idea and a couple $1,000s. And we have now over 8 partnerships with more than 6 functionalities, serving over 3,000 users across the United States. And one of our partners, the Family Rescue Center, which is actually located in Los Angeles, recently told us that our service was game-changing, and they are currently able to reach over 700 of their clients and distribute over 65 packages of food almost every day. And so with the growing digital divide, COVID SMS is definitely needed in a lot of vulnerable communities, and we are a growing team. And so if anyone has any questions or would like to join our team, we would be more than happy to have you. Thank you so much. Thanks for my sharing.
Awesome, thanks. That was so cool to see how that works kind of in a live demo setting. As a reminder, we're going to do questions at the end, but audience members, do feel free to put questions in as you think of them into the Q&A box. And next up, we will hear from Alexandria.
I'm just gonna confirm with you guys that you're able to see only my PowerPoint currently.
Yeah, looks great.
Okay, great. Hi, everyone. As I've been so kindly introduced, my name is Alexandria Lee, and I'm one of the co-founders of Students versus Pandemics. Really happy to see so many of you here and interested during such a busy time. So thanks for carving out a bit of your calendar. So I believe you guys have heard a bit about me. And so I know it might be a bit difficult through Zoom, but I'd love to get to know all of you better. So if you guys could type in the chat what your area of study is or field of interest, and maybe even where you're calling in from, I'd love to get a better sense of who's all in the room. And let me see if I can find where the chat is. Oh dear. No. Okay, so I'm not actually sure where I put my chat function. I'm so sorry.
I haven't seen anyone answer, but feel free to either in the chat or the Q&A kind of introduce yourself for the audience members. Mine is showing like near the bottom if you press chat, but I know sometimes when you share the screen, it
Yeah, I think I accidentally hid my floating chat, like the toolbar. But okay, regardless, as you guys respond, I just wanted to say that I'm really excited to meet you all. Knowing that you guys are passionate about crossing disciplines between the sciences and policy and um, uh, service in general. Public health and leadership really requires that interdisciplinary collaboration from leaders like all of you. And so hopefully if after my spiel, you guys are still interested in partnering with or even joining SVP efforts, feel free to reach out so that we can share and learn from each other's insights and expertise. And now to introduce Students versus Pandemics, I thought it might be helpful to share our founding story. So my co-founder, who happens to also be my sister, Gwendolyn and I came up with the idea for Students versus Pandemics the week that Harvard announced classes were moving online. And that was soon followed by Governor Baker declaring a state of emergency in Massachusetts. Now, at the time, I was at the School of Public Health and Gwendolyn was completing her MPP at the Harvard Kennedy School. And as we were talking to friends at our respective campuses, we realized that there were a few common needs. First, in times of crisis and rapid change, there's a huge need for information and rapidly updated information. But at the same time, it can be challenging to sift through everything that's circulating to find transparent and accurate information. And so we really wanted to improve transparency and communication. Second, even as students wanted to help each other and our broader community, it was daunting to do so as an individual alone. Some students were looking for peers and a way or a platform to channel and amplify their energies. And especially during a time of isolation, we wanted to build and foster a community that was both supportive and collaborative, especially during a virtual time. Other students persevered, launching their own COVID response initiatives, as you can see here. But as you guys probably have noticed, academia is traditionally siloed, and because most initiatives grow out of these communities, response efforts were often siloed as well, sometimes even duplicating efforts and missing potential partners just across campus. And so this was really the third challenge that we saw. Even as Gwendolyn and I talked about response efforts at our respective campuses, we saw this immediate need and opportunity to bring together brilliant minds to come up with innovative ideas and solutions to address COVID. And so within a week of our launch, we had gained over 100 volunteers. And since then, our member base has grown to over 500 volunteers from over 30 different graduate programs, over 20 different undergraduate majors, all working together to address one pandemic. And so, as you guys can see, Students versus Pandemics is a platform built and led by our students. We really value our students, their unique lived experiences, and all of the expertise that they bring. Our commitment to our students and to interdisciplinary collaboration is what I believe makes Students versus Pandemics unique. With our wide network across disciplines and across universities, Students versus Pandemics works to build the ecosystem, to avoid duplicating efforts, and to truly build a collaborative movement. Our mission is to educate, to advocate, and to serve. And so I wanted to share a few of the solutions that SVP members have developed. In an effort to promote education, one of our initiatives led by the Public Health Committee members was to improve health literacy. And this included developing a blog to break down and address COVID developments. I'm assuming, like the group of you here today, many of our members come from a wide variety of academic backgrounds: human developmental and regenerative biology, molecular and cellular biology, immunology, anthropology, and evolutionary medicine. So as an interdisciplinary group, we also recognized the interdisciplinary nature of COVID information. And you can see here some of the variety of topics that we've simplified. We've covered engineers brainstorming and addressing the issue of ventilators in the time of COVID. We've got public health officials pushing the need to wear cloth coverings in a context of insufficient masks. But then how do you make and provide those cloth coverings? We then see designers engaging in the response and sharing how to make them in your own home. And this was alongside scientists with their recommendations and guidelines on safe and proper reuse. More recently, we've been covering and developing a vaccine series addressing from the basics of immunology and biology to the biotech and biopharma sides. And as you guys might have been following in the news, we've also covered Pfizer and Moderna's promising news of new COVID vaccines. We've also developed community engagement efforts, assessing needs and concerns through surveys that we've developed in collaboration with linguists and professors from other schools to ensure that non-English speaking communities are also heard. And then we've also engaged with our communities. In collaboration with community partners, we've organized events to reduce food insecurity, developed virtual educational programs and camps to give busy parents a helpful solution to work from home life. And we've organized donation drives for blood, PPE, and tech like iPads so that COVID affected families have a way to communicate and spend time with their loved ones during an already stressful and worrying time. We also highlight vulnerable communities. For example, one of our committees worked to address the issues women have been facing increasingly during the pandemic, like domestic violence and sexual assault. And then in addition to working on the ground with community partners, SVP also seeks to influence public policy and engage with our legislators. We've been submitting policy memos to the Massachusetts State Senate since the pandemic started, ranging from contact tracing to economic recovery, to equitable access to COVID-19 treatment. Our policy team aims to identify policy gaps and policy solutions for state government. And we've even received positive feedback from our legislator partners, including Massachusetts State Senator Eric Lesser. And so all of these ideas were generated by members themselves because they brought their unique perspective and understanding of the challenges that our communities face during COVID. And so our goal is to provide students with the resources, the platform, and community to act and serve as agents of change. We hope to empower students to become leaders today and to become leaders committed to interdisciplinary collaboration in the future as well. Students versus Pandemics builds this commitment to both interdisciplinary collaboration and public service early in future leaders' careers while they are still students. Today, we are addressing COVID-19, but social challenges will remain in a post-COVID world, and SVP is eager to apply our model to solve other problems related to public health and beyond. For example, the housing crisis is a critical long-standing issue. Med students view housing as a social determinant of health. Design students view it as an architectural intervention. Engineers view it as an urban design and engineering opportunity. We envision a world where change makers lead with humility and a willingness to learn from each other, lead and serve diverse stakeholders, and ultimately lead together. So thank you for sharing your time to hear about Students versus Pandemics and our experiences. And thank you so much to ESAL and NSPN for inviting us to and organizing such an incredible event. It's a huge honor to be able to talk about our growing efforts in a time of crisis. And I hope that I can leave you all with a renewed commitment to service and the desire to work with others from different disciplines and backgrounds to create truly innovative and interdisciplinary solutions. And then please feel free to keep in touch at any of the links here. Thank you.
Thank you. That was great and very inspiring. I'll also read out from the chat. We had a few people responding. We're getting people tuning in from across the country. So we have Josh, who's tuning in from Somerville, who studies atmospheric chemistry. Ivan, tuning in from the University of Maryland, who is studying public health sciences. Chris Jackson, who is at Berkeley studying chemistry, and then we have Mike from New York who is studying biology and applied math. So definitely cool to hear that we have such a variety of perspectives and disciplines joining in. And for the rest of the audience members, if you want to share a little bit about where you're coming in from, I'm sure we'd all love to hear from you. And again, keep thinking of questions for our panelists as well, and typing them in whenever they come up. And so, oh, we have another one, Antara coming in from San Francisco, so another West Coaster, working on developmental stem cell biology. Thanks everyone for introducing yourselves. And finally, we're going to hear from Alina.
Great, thank you so much. Okay, everyone see just my main screen?
Yeah, it looks great.
Great. Okay. Hi, everyone. My name is Alina Kostinovska. I am a PhD student at UCSF and one of the leaders of the science policy group at UCSF. So today I'm here to talk about our project Clean Hands, where we provided hand sanitizer and informational pamphlets for incarcerated populations. So the Clean Hands project began with a communication from an incarcerated person located in San Francisco County Jail, who said that there was very little sanitation going on back in March when the pandemic started, that there was no access to hand sanitizer, and that this was something that they really needed. And so when we started this project, we thought this was going to be a sort of one-time deal where we would provide hand sanitizer to San Francisco jails. And after providing hand sanitizer for San Francisco jails, we actually reached out to San Quentin, which is the prison located outside of San Francisco, and said, hey, you know, we just successfully provided hand sanitizer to San Francisco County jails, which at that time was about 1,000 people. Do you all have any interest in hand sanitizer? And from there, we actually were able to get into San Quentin. And from San Quentin, because we had gotten into San Quentin State Prison, we were able to contact a variety of other prisons and kind of build on that success. And it resulted in this very large mutual aid project in which we distributed 45,000 bottles of hand sanitizer and informational pamphlets, primarily to people incarcerated in California jails and prisons, Black and Brown communities living in public housing, unhoused people and homeless service providers, homebound seniors who live in bridge housing, and individuals in transitional care. So one of the questions that we get most often, and I understand where this question comes from, is why help incarcerated people specifically when there are a variety of other groups like frontline workers, teachers, bus drivers, unhoused individuals. And the reason is that jails and prisons are a relatively unique congregate setting in that not only are you unable to socially distance, but you're really unable to practice any sort of personal autonomy. And these places are often characterized by cultures of skepticism, violence, and distrust. Additionally, COVID-19, as we know, is highly transmissible, and you're not able to socially distance in jails and prisons where there's usually less than 6 feet between cots. Additionally, in California, prisons are overcrowded. There was a Supreme Court ruling some time ago that asked for California prisons to decrease their population as it was considered cruel and unusual punishment. And the solution that California had to this was actually to move a lot of prisons to jails, which resulted in slightly less overcrowded prisons and also overcrowded jails. And so this was really the ideal sort of hotspot for a virus like COVID-19 to spread. Additionally, California populations tend to skew older and tend to have chronic issues for a variety of issues related to our criminal system. And correctional facilities are not equipped to handle a pandemic. So access to medical equipment is limited. It's more like that of an outpatient facility where they have very few oxygen tanks or nasal cannulae or oxygen face masks, all the things that you would need to address COVID-19. And so you can expect disproportionately higher mortality rates in these settings. Additionally, I think, recognize that this was harmful to our community, and we include incarcerated people in that, but we also include the people that go in and out of these facilities every day. It actually tends to be in the thousands for the larger prison systems, and it has the potential to overload nearby hospitals too. Because prisons are located in these rural settings, the hospitals would not be equipped for a COVID-19 outbreak. So I think then the question for us became, why not? So if any other group of people were subject to these same conditions, right? Medically vulnerable, unable to socially distance, this seems like the first population that we should serve. I think one of the problems is that it's very easy to dehumanize incarcerated people, to say that people in jails and prisons deserve less than people who are outside of jails and prisons. And we actually came across that a few times when trying to source materials. But obviously, you know, I think I don't need to preach to the choir for people who know the policy here, but that many people in jails and prisons are there as a result of decades of racist policies that start with over-policing of these communities of color, and then discriminatory overcharging at the level of a district attorney, and then racist sentencing policies on a legislative level. So I think for us, it was the intersection of public health and what we saw as a great injustice. So one thing that I want to bring to people's attention is jails and due process. So one thing that people may not realize who don't really do work in this space is that most people in jails are detained pre-trial. So in San Francisco, about 85% of people incarcerated on a day-to-day basis are actually detained pre-trial. It means that they are factually innocent. And about 80% of them suffer from mental health or substance use issues. In Texas, ultimately, about 80% of people who died from COVID-19 in county jails were not convicted of a crime. And I also want to point out that conviction status doesn't really matter in the context of, you know, who do we provide public health and health services to, and who do we not? So one caveat to this entire presentation is that we want to recognize that the real solution is decarceration. Okay, well, unfortunately that slide has messed up animation, but hand sanitizer and informational pamphlets are essentially important harm reduction tools for people who are incarcerated. But from a humanitarian public health perspective, reducing COVID-19 in our community and saving lives, decarceration is really the only solution. And we've seen that play out in the data. Early on in a study in March from an anonymized jail, decarceration efforts decreased COVID-19 transmission in this jail by 56%. Additionally, asymptomatic testing following this decarceration effort decreased COVID-19 transmission by another 76%. So hand sanitizer and sanitation is really the baseline, and then these decarceration efforts on top of that produce these kinds of results. And so this, you know, early on in this process, I think people in the space sounded the alarms of, hey, jails and prisons are going to be a place where infection rates are going to be really high and death rates are going to be really high, and we should do something about that now. In March, Rikers Island infection rate was 7 times that of New York City. In July, in the Journal of American, in JAMA, the COVID-19 case rate for prisoners was 5 times higher than the US population case rate. And by September, we're seeing huge disparities between the death rate and the COVID-19 rate of people who were incarcerated compared to the general population. So in Arkansas, that disparity was 20 times, in Ohio, 11, and in California, it was 2. I will tell you now that number has gotten far worse. So I just wanted to say where the United States is now. We have about 182,000 cases in people who in incarcerated populations nationwide. In California, we ended up having one of the worst outbreaks at San Quentin State Prison, who interestingly at the time of the outbreak chose to stop accepting hand sanitizer, a policy decision we still don't understand to this day. But they also chose to transfer 121 medically vulnerable people from California Institute for Men, a prison that we also served, to San Quentin, despite the fact that science policy experts had argued that these populations ought to be released. So now there's a court case that is demands that San Quentin half their prison population, and that is currently being appealed. So I'm just going to say you all should look at the Marshall Project, but just so you know, right now we are about 6 times higher in terms of COVID cases in jails and prisons compared to people who are in the general population. So getting a little bit to the project and how we got started, we had some set of skills that were applicable to this project, right? We have experience writing one-pagers and discussing with legislators and stakeholders. Like some of the people who presented today, you know, we can digest peer-reviewed literature and explain it in a way that is easily digestible for the public. And we also worked with people who work in criminal justice and health policy space to simplify the language of these pamphlets that did end up going into jails and prisons. One surprising and very simple thing is we had access to ethanol when no one else did. And so we realized we were sitting on in a pretty big trove of something that a lot of people needed and couldn't get. And we have the ability to, you know, produce hand sanitizer on a semi-large scale pretty safely. And so I want to talk about a little bit about what this project looked like and kind of what we were not at the beginning of this pandemic. And the first thing is supply chain managers. So, yeah, so this is a picture, just a few pictures of what the production looked like. We produce this hand sanitizer in a lab space, we bottle it, we label it, we pamphlet it, we count them out for jails and prisons to break up amongst different parts of their prisons, and then we deliver. One thing that I said we are not as supply chain managers, and a really big financial hurdle for us, as well as a sourcing hurdle is small bottles. As you can imagine, everybody and their mother were trying to buy small bottles and produce hand sanitizer in March, April, May. I think bottles are still back ordered through January to this day. So it became a full-time job just sourcing those bottles. And then as well, you can see here on the right, there's a picture of our finalized bottle. You'll see that it comes with this pamphlet. It's also a full-time job to produce these pamphlets, you know, to make sure the evidence that we have is the most up to date, and that we can actually print thousands and thousands of these. So these are just a few more pictures of what production looks like on a pretty large scale, and kind of what these pamphlets look like. This is information that you all may take for granted, but at the beginning of the pandemic, you know, it was actually, there's very little information inside jails and prisons about COVID-19, even though we were inundated with it on the outside. So the next thing is that we were not experts in managing relationships with the press. When we started this, we had this kind of novel idea that we could just do this in private and no one would have to know that we did this. But we quickly realized that we needed money, and that unless we told people what we were doing, that we weren't going to be able to sustain how big this project got, which was ultimately 19 jails and prisons, many of which we are still serving refills to this day, as well as we expanded to providing masks in communities as well as San Francisco jails. And so we teamed up with UCSF's press team, which helped us manage our initial relationships with media, and then we actually sort of formed our own relationships with journalists, and still have those to this day. As I mentioned, we were not fundraising experts. This project ended up costing $61,000, and while we are lucky to be part of a team that is very experienced in grant writing, we weren't so experienced in grant writing that we could secure $61,000. So we ultimately had to rely on crowdsourcing some funding for this, and we were lucky that our project became something that was spread among the community, and we were able to raise about $20,000 through GoFundMe. Then we also were not community relations experts. So when we started this project, we thought that we would be focusing exclusively on incarcerated populations, but it also became clear that communities of color were disproportionately affected. And so we were approached by Jamal Truelove and a variety of other community partners like United Players, neighborhood centers, Home with You the Lines, to distribute these in our communities as well. Another hurdle that we had to overcome was delivery. So we were initially focused on just the Bay Area, but we ended up expanding all the way down to Southern California. And so we ended up having to figure out, you know, the optimal costing of how do we transport thousands and thousands of bottles of hand sanitizer to 3 prisons in one day? And the reason we had to have like a really tight delivery setup is because we were so short on money. We would often have to go to LA and back, and the 3 prisons along the way all in one day to make sure we wouldn't go into the next day of rental service. Again, these are just some pictures of us delivering to California State Prison Solano, to Santa Rita Jail, sorry, and to San Quentin in the bottom left corner. And finally, we were not volunteer coordinators. So we were very lucky that our initial funding and our initial volunteer base was provided by the Democratic Socialist America in the San Francisco chapter. And currently there is his entire job of a few people in our science policy group to coordinate a team of 106 volunteers now. And so to wrap this up, I wanted to also talk about, aside from the implementation sort of challenges, what were the challenges from a policy perspective on this? And the biggest one was convincing institutions that the public health risk outweighed the risk of consumption. So a discussion that we had over and over again was, hey, someone might consume this hand sanitizer. It's essentially 1 shot, 4 ounces, 4 shots of alcohol, right? But at the end of the day, that it is more important to provide adequate sanitation than it is to worry about whether or not someone's going to consume this. And at the end of the day, people who were incarcerated or informally incarcerated told us, if I were still incarcerated, of course I would never consume this. This is really the only sort of lifeline I have to protect myself from COVID-19. And indeed, in the 40,000 bottles that we distributed, there were fewer than 10 cases of consumption. The second challenge was discussing the need for alcohol-based hand sanitizer. So because ethanol was in short supply, the California Department of Corrections began to produce benzalkonium chloride-based hand sanitizer, which actually is not currently shown to be effective against human coronaviruses. And so we had to have a discussion of how inappropriate it was to use benzalkonium chloride, that we would be happy to provide you with alcohol-based hand sanitizer, and have to connect them to previous prisons who assured them that it was safe and that, in most institutions, nobody consumed any hand sanitizer. And then a few more frustrating experiences was we had CDCR institutions back out on us because they got scared about accepting alcohol into jails and prisons. Sometimes at the last minute, like as we were driving up, we had CDCR institutions inappropriately hold and not distribute to incarcerated populations. And we also had institutions, like I mentioned earlier, stop accepting hand sanitizer. And finally, there were a few times where we actually had to decline to distribute because we were not able to get assurances that the hand sanitizer would make it to incarcerated individuals, or because institutions would only distribute at a certain time of day to a group of 50, and that from a public health perspective, that unfortunately was pretty meaningless. And we finally had to, sort of this idea that we would be able to centralize this process one day, that we could go to CDCR, to the state, and say, hey, we have this hand sanitizer, we've been successful in distributing it, could you issue a directive so we don't have to kind of negotiate with every prison one-on-one? And that was something that CDCR was unwilling to do, unfortunately. So I will just wrap up with kind of the way that this project is also ending, is that we received this letter from someone from California Institute for Men expressing, that their gratitude, but also reminding us of that this is actually a collective struggle to stay healthy, which is, I thought, was a really acute policy observation from someone who was incarcerated. So, and in just the final thoughts that I wanted to leave you all is, that I think we're used to being the subject matter experts, but a good learning experience for us is that mutual aid asks people what they need and how we can serve them. We don't parachute in. We received a letter, and while our expertise is science, their expertise is knowing what they need and what conditions are like on the inside. And that while it was in some ways rewarding to, be able to serve about 1/3 of California prison population, It also represents, I think, unfortunately, what is a larger institutional sort of gap in providing a much needed service. And the same thing goes for providing hand sanitizer in San Francisco. We hope that we can lead with and advocating for data-driven solutions. One thing that we know is that, you know, the United States has 5% of the world population, but 25% of the incarcerated population. We have some of the highest recidivism rates, and it's a very punitive system. And so it is difficult to convince people in a punitive system to say, actually, you know, public health is more important than punishment. And so that's something that I think we can hope to continue to advocate for alongside some of our supporters in this, like Dr. Bree Williams, who's the Director of Criminal Justice and Health, for data-driven solutions in this punitive system. And finally, I want to encourage people to take your expertise and improve our communities, to step outside your comfort zone. Just because you're not a politician doesn't mean that you can't get political. I think, as NSPN likes to say, science is political and not partisan. And I think that has rang true for us throughout this project. You know, it is simply a matter of science and public health that we ought to provide sanitation and decarcerate. And I would encourage people to, you know, do your best, listen to the communities, and try something that's outside of benchwork. So with that, I wanted to just thank the people involved in this project: Jack Stevenson, Arthur Arau, Thomas Pospage, Cleo Corn, Pamela Concepcion, Larissa Meyer, Lydia LePage, Hassan El Cairo, Daniel Carmela, Kalena Moscova, and Tricia Variathan. So, as well as Dr. Bree Williams, who is the Director of Criminal Justice and Health at UCSF, Dr. Keith Yamamoto, who is the Director of Science Policy, Vice Chancellor of Science Policy and Research Strategy at UCSF, our volunteers, our funders, including NSPN, and our community partners. So, thank you.
Wow, this has been so cool to hear from everyone. And, you know, especially, I think that presentation in particular highlighting a lot of the intersections of this current crisis with other more systemic societal issues. And I think I want to start by just actually, in virtual events, you don't get to hear the applause of the audience, but I want to give a round of applause. And if people want to use their reactions as well. I think it's really incredible that all of you, being very busy students and professionals, have taken this time to make such an impact in your communities during this time of need. So I'll just start by saying thank you. And this has been super inspiring. And I'll remind audience participants, we look forward to hearing your questions. I'm going to kick us off with sort of a broad question for the panel, for everyone in the panel, which you know, some people touched on a bit in their presentations, but what made you personally decide that you wanted to get involved in the COVID-19 response? And then relatedly, you know, I think it's interesting that everyone represented here took a different approach to tackling this crisis. And so what made you decide to get involved? And then once you knew that you wanted to help, how did you decide which aspect of this very mountainous challenge that you wanted to contribute to? I guess we'll go in the same order, starting with Serena.
So I think that during the early months of the pandemic, my father's actually a physician, so he was a frontline healthcare worker, and I think a lot of us maybe felt like we were just sitting at home and we didn't know what to do while all of these really brave men and women were going out and tackling the disease. And so I think it really came to just like feeling like I could do something with all of the resources that I had and the support system and just all of the brilliant friends that I had. And so kind of answering why we took this approach, I think it really just stemmed from I have friends in all sorts of disciplines. And when we came together, we have like molecular cellular biology students, we have computer science students, we have econ students, and we just have everyone with all of their different experiences coming together to create this service that really can directly impact and help communities with their communication needs. And so I think that's where we really draw our inspiration from.
Yeah, that's great. So sort of you drew it from looking at what skills do we all have, and then how can we contribute. Alexandria, did you want to?
Yeah, I'm probably going to echo Serena's answer. It's quite frustrating seeing our healthcare workers going in and out of the hospital every day and still seeing really bad outcomes in terms of how the US has responded to COVID. And so I think that's a very large motivating factor to be able to do something to provide the actual information and um, make it easy enough to understand so that other people know the gravity and this of the situation. Um, I will say, having gone to grad school, it's amazing how many people are coming in from various different career backgrounds, academic backgrounds. And so really being able to utilize all of their expertise in a centralized platform is what my co-founder and I wanted to do. Um, and, you know, undergrads are very motivated as well. I've found they actually make up more of our organization than our graduate students now. So I think really finding a way to centralize efforts because there are a lot of disparate siloed efforts, just making it one area that you can help each other, provide resources, share resources. I think that's what I really wanted to do.
Yeah. I mean, I'm also in the Harvard system, so it resonated with me when you said, you know, sometimes one part of the campus doesn't always know what the other part is doing, and I think that's great that you thought about that. Yeah, Alina.
Yeah, I think for me, it started with me being part of a different group where I was typically engaging with sort of criminal system reform. And I think when the COVID pandemic hit, it was pretty clear that there were going to be, and you know, there were already actually were from another group in the Bay Area providing hand sanitizer to frontline workers, to people who were unhoused, but that once again, that people who were incarcerated were just going to be an overlooked population. And so I think it was, well, once we got the letter that said, hey, there's nothing in here for us, there's no sanitation, there's no hand sanitizer, I think we were really horrified, and we mobilized for that in a matter of days. And from there, I think the project just, you know, grew organically because we wanted to help more people, and we just never imagined that we would be able to at the beginning of this. So
Yeah. We have a question from Holly, which is related to a question I had as well. She says, thank you for all of your great work. How have your organizations handled questions from your audience or constituents that don't have clear or certain answers, given that the science around COVID-19 is constantly sort of evolving and getting updated? And I guess we can start again with Serena.
So just to kind of clarify that question, so like what do you, I guess, mean with the information that is being
So I think, I mean, this, you know, thinking in the context of COVID SMS, where you're updating people with information, one aspect might be like, how do you, given that this information is constantly evolving, how do you decide sort of what information to provide? I guess you're maybe not necessarily getting direct questions from people using your system, but given sort of this constantly evolving like landscape of information, like how do you triage that and decide what's the most important information to get out to the people subscribe to your service?
Yeah, so that is actually, I think, something that we really grappled with during the early months, in that our first version of our service actually provided statistics. So we currently provide cases and deaths, and we also currently provide zip code specific testing sites. And, you know, during the early months of the pandemic, we didn't have enough tests. And so telling people to go get tested was actually harmful almost, in a sense, and we had to remove that function immediately. And so I think first it's like constantly adapting to the new information that we receive, But second, I think it's our approach in how we work as a team. So all of our numbers and all of our services and all of our functionalities are all rooted on what community leaders tell us is needed. And so any kind of information that's being disseminated, it's all because the community leader took time and we worked with them in creating a user flow in that every text message has been approved and crafted by the community leader themselves. And so all of the information and resources typically are even resources you can't simply Google on the internet, and that they just have in their head and have been directing their community to time and time again. And so I think it's really having this community-based focus that allows us to make sure that our resources are correct and accurate and have the capabilities to serve them.
Yeah, definitely. And Alexandria, your organization has done a lot of work around kind of communication materials. Do you get like do you feel direct questions from community members as well?
I
in
mean,
your work?
I do definitely know that from our community surveys that like the local populations are often confused about what information is accurate and what's not. And so we do have like debunking myths and incorrect facts. We do have those resources available to them that we share. I also think what's good is that because we are a group that is led by students, we also have to be very wary that we are still learning and we're essentially getting the real-time information alongside the rest of the population. And so what's so amazing about Students versus Pandemics is that we are based in incredible institutions. And so we've developed skills incubator series for our members to utilize, where we bring in professionals and professors who are experts in these fields, and they can advise and share their thoughts on where the pandemic is taking us, where vaccines, whether or not vaccines will be helpful, like which ones will be effective and which ones might be more risky. And so we are trying to provide members like a certain amount of value as well in teaching and providing the resources so that they can make their own critical analyses and be able to provide that to the general public in a way that's easy to understand. So I think when we grapple in terms of constantly changing information, I think we're also trying to make do with what we have and give back our best efforts.
Yeah, definitely. Lena, do you have thoughts around this sort of issue of communication and correct information?
Yeah, this was also something that we had to grapple with at the beginning because we produced these sort of 4-page double-sided informational pamphlets. Once they're printed with our logo, they go into a jail or a prison, and we're responsible for that information, and we're often the sole source, right? And so that's actually a lot of pressure for us to be the sole source of information for 40,000 people. And so we thought about what is most useful, and we also talked to people who work in this space, like as clinicians. And so we actually landed on some really concrete things, which were what are symptoms of COVID-19? What are the more severe symptoms in which you have to seek immediate attention? And that was something we really have to think about, because if you're going to try to seek immediate medical attention in a jail or a prison, that's sometimes difficult, because there's they don't really need it, or maybe they're faking it. And so it's a pretty high hurdle to say, no, at this point you have to insist that you see someone, right? Then we also had the problem of like, well, how does COVID-19 spread? There was early discussions of, is it airborne or is it not? And how do we define that? So we landed on language like respiratory droplets and how many feet. We talked about how can you prevent the spread? And we made that really specific to like, actually, how do you rub your hands, for how long, where does it go? You can actually use our hand sanitizer to disinfect surfaces if you're, really in a bind. And so that's something that we wrote onto our pamphlets. And the last thing I think everyone struggled with at the beginning is, how do we describe how dangerous it is? Which is to say, we don't want to talk about infection rates because testing isn't where it needs to be. And so we landed on providing death just the number of deaths, not as a percentage, by age category, so that at least it reflects a trend in who is most likely to be vulnerable. And those are actually like the really concrete things that we landed on, and that also prepared us for discussions that we had in communities about what we know and what we don't, and also getting people to wear masks, which was kind of the thing that we had to talk about a lot more when we actually went into the communities to hand out hand sanitizer. So
Yeah, no, it's something that you've all in different ways like grappled with and ultimately done really successfully, which is impressive in this climate. Do you have, I guess, I'm thinking about, you know, as a scientist myself, I've often become like a de facto source of information for my friends and family, even though I am by no means an expert. And I'm sure a lot of people on the call might feel might relate to that. So do you have given your successful experiences, do you have some advice to people about how to be a good source of information, just to the people in our lives and in our communities? Whoever has thoughts can jump in on that.
I by no means would consider myself an expert at all. Just like you, I feel like I have to constantly stay up to date with the news. I do think because we all do come from relatively sciencey backgrounds, we do tend to actually stay up to date with the latest articles and the journal updates, right? So I think that is very helpful. Like I've said before, we are provided such a plethora of resources in our professors and schools. And so even as an alum now, I still attend a lot of the events that Harvard Chan School puts up in terms of like vaccine efficacy recently, right? And they really stay up to date with the news. And so while I often warily advise my friends and family, I also do try to give them the best understanding that I have based off of the information I've read. But yes, I'm careful to give that advice.
I guess a lot of it is having the resources and kind of knowing where to go is an advantage that we might have. Any other thoughts on that?
I mean, I think Alexandra really hit the nail on the head there.
Yeah. We have another question from the audience. I think for Alina, asking about your efforts, considering the difficulty in obtaining personal protective equipment during the pandemic. How were you able to secure, like, what was your source for securing hand sanitizers?
Oh, maybe I wasn't explicit about this, but we produced the hand sanitizer at UCSF, and that was sort of the main source. It's ethanol, glycerol, and hydrogen peroxide. It's based on the WHO Formula 1. So that is how we had hand sanitizer where no one else did. Is that we made it? We didn't just package it. With respect to masks, I would say that was pretty challenging, and we actually had a pretty limited amount. It was enough to distribute to the communities, and we got those mainly through our community partners. There's actually interesting thing where people were like, oh, if you give me hand sanitizer, we'll give you masks. And we're like, no, it's not a trade. You can just have the hand sanitizer. And then people were like, no, we think it's important work you're doing too. So here are some masks. And so that was a kind of, I think, another sort of interesting thing of working in the mutual aid space is like, it's not just between you and the community partners you have, but it's also between the other organizations like doing this work. So
I love the photos you had of all of you cooking up the hand sanitizer in your lab. Those were very cool.
yeah.
We have one question about COVID SMS, asking if you've considered making it international, or even, my understanding is COVID SMS is focused particularly on your community. So yeah, have you considered efforts to expand the reach of the service?
I think definitely we're still a little bit of working through domestic problems right now. It's definitely been a learning experience, but I think that SMS is so important, especially for international countries, especially for they do use a lot of SMS when it comes to research studies or communication, especially in more developing countries, because everyone, like low-income Americans, have a phone, and it is the most accessible way to communicate. And most individuals, in fact, don't have internet access and don't have computers, iPads, like tablets, especially in other more developing countries. And so that is something that we're definitely interested in. But as of right now, our hands are very full with America's problems.
Yeah. I had a question myself related to that, which is assuming there's sort of an end to this situation, do you anticipate that COVID, that this technology that you set up could be used for other purposes, like maybe like environmental health issues or other public health information within the community?
Definitely. I think one thing that we have learned is that we really are a text messaging platform. And so a lot of our partners actually use our service not only for COVID-19 information, but just to talk about basic resources and information that they have. So for example, if there's food available, they'll send messages about food. And so I think one of the biggest things that we've learned is this digital divide and how low-income Americans don't have access to technology and don't have technology literacy that existed before the pandemic. It was only exacerbated by the pandemic. And I mean, unfortunately, it will continue to be there even after COVID-19. And so we definitely do see our usage not only in the health sphere, but like you said, when as a team, we've been talking about other ways that people can send information via text. And especially with the election, we were talking about reaching to people about voting. And so there's like being a platform allows us to have a lot of different usages.
Yeah. I guess might kind of swing a similar question up to Alexandria, which is where do you anticipate seeing students versus pandemics going if and when the COVID-19 crisis resolves? Do you see this being something that the group continues to focus on other outbreaks and other public health issues within the chapter communities?
Right, so that's a great question. Obviously, we're very much hoping that pandemic will be over in the foreseeable future. But yeah, so we do want to become a sustainable long-term organization. And so we may be rebranding as Students Versus. And there, as I mentioned earlier briefly in my PowerPoint deck, there are plenty of social challenges left to address. And students are such an incredible source of ideas, manpower. And so in the future, we would like to be able to have Students Versus be addressed to any social challenge that our chapters want to face. Our national chapter is currently in the process of applying for all of the grants to fund all of these efforts. We are currently incubated at Harvard iLabs Innovation Labs. So we're also getting funding from them as well, and mentorship from a bunch of CEOs who have experience in nonprofits and all of that. So hopefully we're gonna take this not just in the US, but also to Canada in the near foreseeable future and maybe internationally, who knows?
That's awesome. Also sort of looking ahead to the nearer future, we have an attendee who asked, how does the possible creation of vaccine change your goals moving forward? Will you sort of be incorporating that more into your community-based efforts? I'll leave that open for anyone.
I can take that. Yeah, I think for us, one of the things, we'd like to say that in the future, we'll be able to maintain these connections and distribute information. And like the unfortunate thing, that's probably not going to be the case. And the reason is that it is so difficult to get prisons to distribute hand sanitizer, to have a bunch of wardens and guards do that work. And so if we come back later and say, actually, we'd like you to just distribute thousands of pamphlets just because we think it's really important, that's probably not something we're going to be able to sustain in most prisons long term. And so one thing that, as relates to vaccines, that was a discussion that was had in the space early on, and advocacy work that we're hoping to do, is that when it comes to testing, there's actually the argument to be made that prisons and jails should be prioritized for testing, which was the resource that we had available at the beginning of this pandemic, because they're congregate settings and because they can, spread to the rest of the community, and because they'll be the sites of outbreaks. And that was really difficult for people to be like, you want me to prioritize people who are in jails and prisons? Yes. And I think we might have to have the same discussion about vaccines, which is that you should prioritize people who are incarcerated, even though everyone is going to want the vaccine. It's going to be a somewhat limited resource, and the best use of that resource are in hotspots, right? And one hotspot, for example, is obviously incarcerated populations. The way this project is actually ending is that our last batch is going to go to the Navajo Nation, most likely, and maybe also the Hopi Nation. And those are also the spot of outbreaks. And so making those decisions and advocating for who should get a limited resources, I think hopefully where our sort of policy work takes us next, and kind of a similar challenge that I perceive. So.
Yeah. Caitlin from the audience also had a similar question around how does news, both the vaccine, but also things like recent surging of cases, like change or influence your work? Like, have you found that kind of more broadly? Have you been thinking about your efforts, or where you focused your efforts has changed as we get kind of continuous updates on what's going on in the US or across the world?
I'm just gonna jump in and just briefly talk about the vaccine update, right? Yeah. I do think it's definitely very good news for us. Unfortunately, I do think in terms of vaccine hesitancy, there's a lot of that discussion going around. And so on the education front, I'm hoping that Students versus Pandemics can clarify more about vaccines. That's why we have a series on vaccines. The ones that Pfizer and Moderna came out with, I think, are mRNA based. So they shouldn't be too concerning in terms of risks. I'm wary again to advise on that. So providing that information and reassuring the population is very important. I also think Alina was so on the spot, on the dot for targeting who gets the vaccine first. And so I'm hoping that our policy team can potentially draft memos to our legislators talking about who should be getting the vaccines first. Obviously, healthcare workers will be top priority, but also vulnerable communities like incarcerated individuals are also next up on the list. I think that's incredibly important to address before like maybe the rest of the population. And then in terms of policy as well, I think because funding has been directed more towards the development of vaccines as opposed to distribution, it'll be very difficult for vaccines to be distributed until by spring, roughly, I would imagine. And so like being able to tell the public, reassure them, and also get legislators moving, I think that will be our next steps. And then finally, on the service front, obviously maybe setting up ways and connections with clinics to offer vaccines, or maybe mobile clinics so that various communities can get access to vaccines will be very important as we move forward. Sorry, that was a lot.
Oh, it's great.
Anyone else want to jump in?
Oh, sorry. I was just going to add, I think that with the changing news, and especially with this new information about a vaccine, like Alexandria was saying, who's going to have access to these vaccines? And disproportionately, vulnerable populations won't have access to them. Not only will they not have access, but they won't have the information as to how to even receive a vaccine, even if they were given the opportunity to. And so I think that's why our team at COVID SMS really understands that how they're going to get this information is from community leaders. But if you are not able to congregate in physical settings, and you're not able to read the news or listen or watch the news or Google things to educate yourself about these vaccines or where to get access to them, then ultimately you're falling through the cracks. And so I think with our team at COVID SMS, right now we have testing sites, but I can foresee in our future that we will have where to get your vaccination, when you can get your vaccination, like what is the information that needs to come with a vaccination. For example, do you need to get a second shot in a month? And so all of this information that we're constantly learning about, most Americans actually aren't. And so I think that when it comes to these FAQs that we have via text message, updating our information about vaccinations and current news will be especially important.
Yeah, I think so. One thing that I wanted to address in response to your question, I guess, about the surge part, which is that early on, a lot of institutions are like located in more progressive places. Like San Francisco has a progressive district attorney, Jason Boudin, and he worked very hard to decrease the prison, to decrease the jail population, right? And that also, there's also a variety of legal things. For example, the policies for which, or the crimes for which $0 bail was set have been reverted back, not by the district attorney, but by the superior court system here in San Francisco. And so now there are more cases in which you actually sit in jail, just waiting for something that is going to be a pretty small charge to begin with. And those charges were normally an automatic, okay, you're actually not going to sit in jail. And so the sort of larger trend is a lot of these policies that were good at the beginning to decrease jail and prison populations were kind of went out the window and were reversed. And that was frustrating. And same thing with hand sanitizer. They got one batch, maybe two batch, and said, oh, we don't need any more. And we were telling them, in our expert opinion, we do anticipate a surge come fall, which is what we're living through now. And that was really difficult for people to grasp. And then sometimes they'll come and say, hey, like, we want to get hand sanitizer now. And like, we're happy to provide you hand sanitizer, but if you're at 75% infection rate, it's a little late now. And so that's been sort of the frustrating thing about the surge for me, is that it's something that we could have and did anticipate. And the policy decisions in CDCR really did not reflect that. And across many district attorney offices in California. And then the last thing I just wanted to say on this was, I also wonder what our copay policy is going to be like in jails and prisons across the United States. So a lot of states suspended their copay policies, except for Nevada, Hawaii, and Delaware, at least back in the summer. So people still had to pay copays to get medical care in the middle of a pandemic when you don't make any money in a jail or a prison. And I wonder, will those stay suspended, right? And will they stay suspended only till the vaccine, or till, we actually have achieved herd immunity? So those are some of the things that have been sort of frustrating about the surge and some kind of policy problems I anticipate moving forward.
Yeah. A lot of difficult and interconnected issues. I've been saving this question from Holly for the end, and I imagine this is something a lot of folks will be interested in hearing your perspective on. So Holly says, I love hearing our expertise is science, their expertise is what they need. That was from Alina, talking about the concept of mutual aid. So she asks, what advice do all of you have for scientists and engineers that are seeking to engage with their community members in meaningful ways to advance public health, racial justice, and beyond? I want to start. It's a big question.
I can start. And I think a lot of it comes from my public health training and background, and understanding that community leaders and people who are living in their communities know their problems, needs, ever more so than I ever could. And so the advice that I would give would be to physically just go out, volunteer at a food pantry, and go with open ears, and listen and talk to people. And I think that's what we do. Our community outreach team, all we do is we call community leaders, we set up meetings, we ask them how we can help them, we tell them what we can provide. And if they have even additional needs, then we'll come back to our team and we'll be like, can we make this? Like, they need it, can we make it? And I think that, like, being patient and understanding that they're also extremely busy. They're dealing with basic needs such as food, shelter, water, and we're creating almost a luxury for them, communicating. And so I think really just making sure that you go in with an open mind, an open heart, and open ears to understand and really understand what they're asking for is the best first step.
And if I could actually follow up, and maybe each of you could talk about this a little bit if it applies as well. When you say following up with community leaders, like who specifically are you talking about? Sort of, or, yeah. And do you have advice for people just taking that first step of like, you know, which like where can you sort of look as places to get engaged with the community, and um, who are sort of the relevant community leaders that have been important in your efforts?
Yeah, of course. And so I would say most likely in your backyard, there is a community of need. And so at Hopkins, we live in what we always call this Hopkins bubble, but we live in Baltimore. That's where we really live. And Baltimore is a place of great need. And so just an example of how I started volunteering at Healthcare for the Homeless in downtown Baltimore is that I knew I wanted to volunteer there. And so I reached out to the volunteer coordinator multiple times. And so I think that's just the first step in reaching out. And kind of touching upon how we reach community leaders with COVID SMS, we do cold calls and we do cold emails. And so we actually just email community leaders. We find different resource centers, we find different shelters, we find food pantries, we find their contact information and we call them. And we email them and we tell them, hey, we're a group of students, we have this resource and we'd love to give it to you for free. And typically people are very receptive to talking about their needs and their problems. And so we set up a meeting with them and we just get to know them. And I think a lot of community work and a lot of public health work is building relationships based on respect and dignity and trust. And so unless you have those conversations with people, you will never really find the meaning of, I think, real servitude.
Yeah, well, that's great advice. Other panelists, thoughts on this advice for folks getting involved in their communities?
I guess I definitely agree with what Serena said. Maybe a step even before that is also maybe from an older person's perspective, yes. But as scientists, I think we all know the long hours of being in lab or behind the computer coding and analyzing big data. And so it's hard to get that humanistic perspective sometimes. We already feel overwhelmed by all of the work that we have on our plate, but and sometimes obviously people are getting exhausted by all of the news that you read and on the internet. And so I think being able to take a step back from our own little bubbles, even just taking a small step to interact with your peers who probably also come from very amazing backgrounds and have their own perspectives is perhaps a first step. I know a lot of our members on Students versus Pandemics, even in the policy team, they are going to School of Public Health, they're going to business school, or obviously they're going to the Kennedy School on policy, but they are able to provide that perspective that us scientists might not have considered. Often we'll think, okay, our governments are not doing the right jobs. Sometimes we're frustrated because we know the science, but it's also important to get a better understanding of what they're considering, what the problems they're facing are, in order to collaborate and make something that is actually effective. So I think that's an earlier first step for us scientists. But yes, absolutely echo what Serena has just mentioned.
Yeah, thanks.
Yeah, so just to clarify, the question was about what is the advice you would give for others who want to get involved in their community? Is that right?
Yeah.
So not to be a broken record, but I actually think both Serena and Alexandra hit some of the things that I wanted to say. Serena was very good, I think, about kind of explaining mutual aid work and listening to the community, right, and not sort of parachuting in. And I think the answer really is get involved now. I think one of the things that came out of this hand sanitizer project was that it wasn't like a sort of random thing that we all engaged in. It was some of us had already been working in this sort of criminal system space. We had actually hosted the largest district attorney debate in San Francisco at UCSF in the previous year. And so when this happened, we had kind of a network of people who at that time, well, Chase then became the district attorney of San Francisco. There are a variety of public defenders, and that was, communities really come down to like networks. From a really science perspective, there was some study on networks and of communities and nodes, and the best way to get trust is actually just to target the nodes instead of going to every individual community member and building from the ground up, right? And that's saying there are people who have been doing the work, right? You could be one of the people who are doing the work now. And I think Alexander touched on this, is that a lot of people, especially, you know, our age, I'm in grad school. I'm a bench scientist. I pipette every single day. And I think a lot of us kind of say my identity is scientist and forget that like my identity is also, I'm part of the San Francisco community. I live in the Mission, a historically Latinx community that has, you know, has had pretty significant gentrification, right? And so if you get involved in that work now, you know, you pick your community organization or the issue that really speaks to you, then you'll be really prepared for, I think, when the time comes to really serve your community. You kind of already know those network nodes and say, hey, I heard that this is a problem. Can you help me get to like the district attorney of Santa Clara, right? Or you're a public defender. Can you help connect me to a doctor that's friendly in this prison who will convince their boss that you should really let us in, right? And that was like really the work of this is, hey, like, please let us in. And so I think, yeah, the answer to that is sort of get involved now. You're more than a scientist. You're also a person. You maybe forgot because you spent 60 hours in the lab. But, you know, just a few hours every week, I think can help. And I also want to say from like a less altruistic perspective, these skills really transfer, right? Like if you're doing organizing work, you're probably organizing a volunteer team with like a ton of spreadsheets and a ton of documents, and you're used to creating infrastructure. You're probably resolving conflict all the time, managing a team, and all of those things actually do really come into handy when you have to go into your own lab, right? And resolve conflict and organize, you know, organize things, manage supplies, actually on a much larger, on a much smaller scale than you do for something like this, the COVID-19 hand sanitizer project. So I think my suggestion would be building off what they say, you know, get involved now so that you are one of the people who is integrated into the community, and who knows that. And if you're not, then, you know, you can always find those community leaders by, you know, calling them and reaching out and letting them know that you are there to help and that you really care. So.
Yeah. Well, this has been an amazing discussion. I just want to thank, it's the top of the hour, so I want to let people go, but I want to thank our panelists once again, both for your incredible work and for sharing your time and insights with us today.